want to go to the Obamacare architect himself, Dr. Ezekiel Emanuel. Dr. Emanuel, thanks for joining us.
Nice to be here.
Would you agree that the plan as it is now is in deep, serious trouble, even perhaps in a death spiral?
Well, Representative Ryan's plan does appear to be in a death spiral.
The current Obamacare plan.
You have the Freedom Caucus, which has said it doesn't like Ryan's plan. And you also, by the way, have every major medical organization voting against Speaker Ryan's plan. The American Medical Association came out against it. The American Hospital Association came out against it. Doctors and hospitals are against this plan. It is definitely going down because there is extreme opposition.
The current medical system as it stands now.
Oh, the current medical system. Look, no, Obamacare is actually doing quite well, better than anyone expected. On access, 22 million people got coverage. On costs have actually moderated. I know the president
is moderated the same as.
Let me finish,
well,
sir.
I know, but let us have a conversation, okay?
Sir,
if you want me to just say go for 3 minutes. I'm just saying you're saying things that are not correct, and I'd like to ask you about them individually instead of a filibuster, if we can do that. Okay, you talk about costs moderating. People have seen their premiums go through the roof. Let
me explain, okay? Premiums are going up. Under George Bush, his 8 years, premiums went up 80%. Under President Obama, they went up 35%. In the last year, you have a jump in premiums in a few markets. I noticed you didn't mention Massachusetts or Indiana, where premiums in the exchange actually went down, or California, a huge state, where premiums went up only 7%.
I haven't mentioned any
You have
individual
been cherry-picking. Would you let me finish? You have been cherry-picking your data and not giving an accurate representation to the country. It is true there are some unfortunate people. They tend to be of two groups. The very healthy who are getting a very sweet deal before because they weren't actually, they were being underwritten, and young people who were also getting a sweet deal because they're generally healthy. Older people have actually done much better under Obamacare. And when you compare, say, someone who's 55 in Obamacare compared to Representative Ryan's plan, under Representative Ryan's plan, they're going to be doing substantially worse. It's estimated a household under Representative Ryan's plan with a head of a household who's 55 years and older will pay $7,500 in total health care costs more under Ryan's plan than under Obamacare. That is not cost savings.
Okay.
And by the way, last thing, the $350 billion that Representative Ryan wants to give in tax cuts are to people making $250,000 or more. It is actually going to devastate Medicare and devastate the government's finances. It is a giveaway to the rich.
A lot of people, here's a couple of things, okay? First of all, the notion that this has worked when half of these people that you're talking about, the 20 million number, have been pushed onto Medicaid, which is straining state budgets and will, by the way, after this initial Faustian deal expires, is really dangerous. And it will mean subpar care for so many people, particularly older, poor people. We do know that premiums have gone up. I didn't mention any particular state, but if you take them all in total, they have gone up net. They've gone higher. The costs have not been curbed lower. They've gone up. Drug prices are through the roof. So, and then we have the CEO of Aetna saying that this is in a death spiral. So, you can resell it if you want to the American public, but I think they rejected it on November 8th.
Let me readdress your point. I noticed you didn't mention or address the issue that under President Bush, the prices went up much faster, more than double than under President Obama.
They were promised to go down under President Obama.
No health care costs have ever gone down. They have moderated. They increased in line for 5 years with the general inflation, which has never been happened before in 50 years. So that's been a big achievement. I will also say drug prices is one of those places where Democrats and Republicans can agree. We all think the drug prices are too high and they need to be negotiated. The president has agreed with that, and this, I think, is a nidus of bipartisan agreement. I notice it's not in Representative Ryan's bill at all. He wants to do nothing about drug prices, which you have mentioned as a serious point. That is a deficiency in this bill.
Right.
So
and I think
the bill is inadequate in many ways.
Might help resolve that. But overall, I think the American public...
Can I also say one more thing? Can I just say one more thing?
Sure.
You complain about the fact that 10 or 11 million people have gotten Medicaid as part of Obamacare. Now, one of the interesting facts is if you actually survey those people, they're very happy with their Medicaid.
Okay.
It turns out that they have great satisfaction with the primary care doctors
speaking of surveys,
they can get,
because I've only got 20 seconds,
they do actually like it.
Well, people who have actually used Obamacare in any survey are unhappy with it. They lost their doctors. The quality of care has gone down. And last year, the life expectancy in America crashed.
Wrong.
I mean,
something
is wrong with our healthcare system.
That is fake news.
Something is wrong with our healthcare system. It was not addressed in Obamacare.
Most people who use Obamacare, whether on Medicaid or in the exchanges, are actually happy with it. Your claim that most people hate it is just fake news.
Dr. Emanuel, I know it's your baby, but it's got a lot of problems. We've got to leave it there. I appreciate you coming on with me and letting me even talk a little bit. See you soon.